Think you know everything about Medicare? Here are a few unpleasant facts that may surprise you. As always, if you have questions about your Medicare or health insurance, you can reach us in the comments below or at the number on the screen. Remember, we are licensed nationwide and there is no charge for our services. So today we're going to go over some of the surprise gotchas in Medicare that you may or may not know about. Make sure to stay tuned to the end. Let's start with a big one, which is Medigap. Medigap plans are also known as Medicare supplement plans, and they are different than Medicare Advantage plans, which we will talk about later in the video. They're a type of voluntary insurance to supplement the financial gaps of Original Medicare. Now, Original Medicare offers truly great and low-cost, fully comprehensive health coverage. However, in addition to monthly premiums, there are also deductibles to meet, copays and co-insurance, and there are no out-of-pocket maximums. And this is where Medigap steps in. Now, if you enroll in a Medigap plan, there will be an additional premium to pay. However, this additional supplemental plan will help to cover or possibly entirely cover those deductibles and copays and co-insurance. So basically, you'll have no additional charges or very, very minimal charges when you actually utilize your health insurance. Now, when you're younger and healthier, oftentimes the costs associated with Original Medicare are relatively low. But as you get older and your medical needs become more extensive, or perhaps you're diagnosed with a more serious medical issue, then you may find that those copays and coinsurance and deductibles are rather exorbitant and just no longer financially feasible, especially because there is no out-of-pocket maximum. So these bills can continue to stack up and stack up and stack up. Now at this point, you may think to yourself, it's time to enroll in a Medicare supplement plan. However, if you wait until you're older or have more extensive medical needs, it's likely that you will be denied. Or if you're not denied, at the very least, you're going to be charged more than you would have if you had enrolled when you were younger and healthier. This is because most of the time, Medicare supplement plans have medical underwriting. However, if you enroll in that first 6-month window after you turn 65, and enroll in Medicare Part B, then you actually will not be subject to medical underwriting. So this is absolutely the best time to enroll in a Medicare supplement plan. Now, you may not use it in the earlier years, but your later self will definitely thank you. Speaking of enrollment, there are some other enrollment periods that you should be aware of, as well as enrollment late penalties. Specifically, we're talking about the Part B late enrollment penalty and the Part D late enrollment penalty. So let's start with the Part B late enrollment penalty because it is significantly larger and more impactful than the Part D one, which we will talk about in just a moment. So you'll first become eligible for Original Medicare, which is Part A and Part B, when you turn 65, during that 7-month window surrounding your 65th birthday, 3 months before, the month of, and 3 months after you turn 65. During this time, it's likely that you'll be automatically enrolled, and if so, you should receive your card in the mail. Now, if you do not receive your card in the mail, or if you're not automatically enrolled, it is imperative during this time that you contact Social Security. You should also know that if you are working past the age of 65 and maintaining creditable coverage through your employer, then you may wish to defer Part B. But once you retire and you lose coverage, at that point, it's very important that you contact Social Security. That way you're not subject to that Medicare Part B late enrollment penalty. Now, if you are subject to the late enrollment penalty, then you will have to pay 10% of the base monthly premium for each 12-month period that you are without Part B. And that is, of course, on top of your Part B premium. Now, in 2024, the base Part B monthly premium is $174.70. So if you were to go for a 12-month period without Part B, then you would have to pay 10% of that, which is $17.40, on top of your Part B premium. If you were to go 12 to 23 months, that would remain the same. But once you hit that 24-month mark, because that's the next full 12-month period, it would jump to 20%. So now you'd be paying $34.80 on top of your Part B premium. And remember, this is not a one-time penalty. It gets tacked onto your monthly premium forever. Then there's the Part D late enrollment penalty. It's much less significant than the Part B late enrollment penalty. Part D are prescription drug plans, and you're definitely going to need some type of prescription drug coverage as you get older. Now, if after becoming eligible for Original Medicare, you go for a period of more than 63 consecutive days without creditable prescription drug coverage, then you will be subject to the Part D late enrollment penalty. Now, the Part D late enrollment penalty is 1% of the national base beneficiary premium, which in 2024 is $34.70, and then that's going to be rounded up to the nearest 10 cents. So I know that math problem seems a little complicated, but it's really not very expensive. So past 63 days, let's talk about 3 months. Let's say you were to go 3 months without Part D coverage. Then that 1% in 2024 would be $1.04 on top of your Part D premium, whichever Part D plan you enroll in. For 4 months, it would be $1.39, and for 4 months, it would be $1.74. And there are plenty of free calculators out there to help you calculate your Part D late enrollment penalty if you are subject to one. Another common Medicare surprise actually isn't so much a surprise as it is a common misconception, which is that many people think that when they sign up for Medicare Advantage, that they're signing up for Original Medicare or even a Medicare supplement plan. And they are absolutely not the same thing. So Medicare Advantage plans are offered by private carriers. So there are pros and there are cons. Now with a Medicare Advantage plan, there is an out-of-pocket maximum, which is a great thing because it'll protect you from major medical bills. With Original Medicare, there is no out-of-pocket maximum, which means if you have major medical needs and you don't have a Medicare supplement plan, you could be on the hook for some very, very big bills. Additionally, with a Medicare Advantage plan, your premium is determined simply by the plan that you choose, and there are some very inexpensive plans out there. With Original Medicare, your premium is determined by your income. If you have a higher income, then your Part B may be more expensive, and you or your spouse's work history. So you may qualify for free premium Part A if you or your spouse has worked at least 40 quarters. Additionally, with Original Medicare, there are set deductibles, copays, and coinsurance, so that certainly makes things easier. With Medicare Advantage, it varies by plan, but generally speaking, you'll notice that they have lower deductibles, copays, and coinsurance when compared to Original Medicare. With Original Medicare, there is no dental, vision, hearing, or prescription drug coverage, as mentioned earlier in the video. However, Advantage plans may offer additional benefits like dental, vision, hearing, and prescription drug coverage. Now let's talk about some of the negatives. So with Original Medicare, there are no referrals or pre-authorization. So if you need to see a specialist, you can simply go see a specialist. You don't need to get a referral from your PCP, and there is no pre-authorization standing in your way. Medicare Advantage plans are known as managed care plans. So even if you opt for a PPO and you don't necessarily need a referral, there will still be the issue of pre-authorization. Additionally, with Original Medicare, there are no networks. So if your doctor or hospital accepts Original Medicare, and almost all do, then you can pretty much go to almost any doctor or hospital. With an Advantage plan, the networks can be rather restrictive, and many people actually report having to travel significant distances to find a doctor or hospital that is in network. So if you had any Medicare surprises that you had to learn the hard way, let us know in the comments below. Of course, you can also reach us in the comments if you have any questions whatsoever or at the number on the screen. We are, of course, licensed nationwide and there is no charge for our services. As always, thank you so much for watching and we'll see you next time. Bye-bye. Before you go, make sure to like and subscribe to stay up to date. And if you want to learn more about some Medicare surprises, make sure to check out this video that covers what Medicare doesn't cover. See you next time.